Thank you so much, Celine, for the introduction. It's an honor to be here. I'm so excited for what you are doing with these clinical case presentations. I watched the first episode from last month and learned a lot and found it very, very helpful. So I'm honored to be here tonight to share some of my experiences. As Celine said, I've been around for some time now. Click, Katrina. Yeah, okay, sorry. Yes, I've been in clinical practice for 43 years, and my passion right now is to share a lot of the clinical pearls that I've gained over my years of practice that have really transformed my practice and really brought a lot of clinical success and benefits to my patients. I've had the honor of being mentored by many very astute and very well-known practitioners over my career, and it's an honor to take some of that knowledge and pay it forward, as some of these people have now retired. So what we're going to be doing tonight is telling you a little bit of my personal story of how Meridian Balancing came into my life. As with so many things with practitioners, it's our personal stories, it's our personal hurdles and challenges in life that lead us down a career path that often is where we find our passion. We'll explain a little bit about what Meridian Balancing is, how it is a root treatment, and how it can affect healing blocks, as I like to call them. Microcurrent is a fabulous way to provide a very effective non-needle acupuncture treatment. And then I'll share quite a few case histories of various people and patients that I've treated. And then we'll have lots of time for Q&A.
All right. Sorry, Carla.
Yes.
I just forgot to mention that all the Q&A we'll do at the end of your presentation. So if anybody has any questions, if they can put it in the Q&A section at the bottom of your screen, and then I'll see them and then I can read them out to her at the end. So we don't need to interrupt you in the middle.
Perfect. That would be awesome.
Thank you.
All righty. All right. So my story started, I started my acupuncture training under Dr. Stephen Aung in 1987. And in 1989, I was following him around in his clinic doing some internship with him. And my son at the time was dealing with a very mysterious illness. For several months, he had been waking up in the morning, throwing up. One time he was actually throwing up in his sleep. He couldn't eat anything at all until about 11 or 12 in the day. And if you tried to force him, it would just come back. We had done everything Western medicine-wise. He'd been checked by everybody. And we were at the point of them wanting to do a gastroscopy on my little 2-year-old. I happened to be with Dr. Aung in his clinic, learning from him, and mentioned this situation. And he said, bring him to me at the end of our session here. And so I did have my husband bring him in, and he pulled out the Accu-o-matic machine, did a Meridian Balancing treatment on him. Kyle's symptoms were his tongue hurt all the time, and he wasn't hungry, this mysterious vomiting. And literally, as we carried him out of Dr. Aung's clinic, Kyle said, my tongue doesn't hurt anymore and I'm hungry. And from that moment onwards, his mysterious vomiting in the morning completely disappeared. So you can imagine, as parents, that we were ecstatic, excited, and I was extremely curious about this treatment that didn't involve any needles and had such a profound effect, and so quickly. And it was a very, very short treatment. So fast forward in my career, in 1993, I purchased my first Accu-o-matic machine. And I very vividly remember Dr. Aung saying to me, Carla, you're going to become a pediatric acupuncturist. And I just laughed at him because I didn't think that was in my future. But he seems to know things more than the rest of us, I think. I can click. Okay. All right. So in 1999, I discovered Dr. Julian Scott. He is a fantastic traditional Chinese medical practitioner that specializes in children. He has written books on treatment of children with acupuncture, and I did a 1-year certification with him. Of course, I had this machine that had the ability to treat a client and a patient, and especially a child, without needles. In North America, it's very rare for people to want to bring their babies and children for you to stick needles in them if they don't know you and they don't understand the benefits of acupuncture, and needles kind of freak people out anyway. So I was doing my case histories every month through my 1-year training program. And literally, I would write out what he would recommend, what he taught us, but I would write out a second answer and say, but I would choose to use this machine and do meridian balancing and treat these points without using needles at all. And Dr. Scott was very adamant that using any machines was not really true acupuncture. And so he was very, very resistant to even considering this, until I flew out to spend a week interning under him. And I had the machine with me because he actually messaged me and said, could you please bring that machine that you've talked about through your whole course? One of the things with children that's a real challenge when you're treating them with needles is having a child who's kidney deficient. They tend to have a lot of fear. That's a normal kidney deficiency symptom. And when you do acupuncture with needles on them, it increases their fear, which makes their deficiency worse. And it's kind of a vicious circle. So it's really, really hard to treat those children effectively. So Dr. Scott watched me use this on the children in his clinic when I was there interning under him, and embraced it and found that it was a wonderful way to provide effective acupuncture to children and to be able to have more children come in for treatments because parents are more willing to do that. Then fast forward to 2003, as Celine mentioned, we developed the Second Chance Facial Rejuvenation protocol. I was very passionate about having something that people would feel younger as well as look younger. So naturally, with all the experiences I had with meridian balancing and using non-needle acupuncture points, we integrated that into this protocol to get that total whole body approach. All right, a little bit of history about meridian balancing. You can go back to about the 1950s and find information from Dr. Nakatani out of Japan and Dr. Akabani, also out of Japan, that used very cumbersome techniques to do a meridian balancing-like treatment and evaluation. So in 1973, Dr. Thomas Wing, who's a chiropractor from the United States, developed the microcurrent machine and the ability to measure the meridians using the Akabani points of each meridian, and thereby being able to very accurately graph and see where the meridians were in their balance. So one of the things that I'm really passionate about with this treatment is that it is a very, very valuable root treatment. What does that mean? It means that it's something that you can offer to any person. You don't have to know anything about their health history. You don't have to know anything about their medications. You don't have to know anything about them. You can literally pull someone off the street, do a meridian balancing, know that you will do no harm, and you will potentially be able to move the needle for their health in a dramatic way. Now, what it does is it harmonizes the autonomic nervous system. And we all know that that's kind of like the central computer that controls everything that goes on in our body. When you do a root treatment, this is how I explain it to my patients. It's like I'm preparing the foundation for any treatment I'm going to do after that. As Celine mentioned, I'm a physical therapist, so I do lots of physical therapy, manual therapy type techniques. I'm an acupuncturist as well. You can do meridian balancing to prepare the body so that whatever other modality that you have to offer them is going to have a better chance of working and lasting longer. I use the analogy of building a house. If you're building a house, you want the foundation to be smooth and level so that when you build up on that, everything's going to work well. It's also considered acupressure because we're stimulating the acupuncture points with a tiny electrical current that people don't feel. So anybody can learn how to do this and apply it. When you have improved body function, when the autonomic nervous system is more balanced and functioning better, then you're going to have that reflected in your face, where you will look more youthful because your youthful looks is a reflection of what is going on inside with your health as well. And that was why we integrated it as well into our Second Chance system. Now, clearing energy or healing blocks, maybe you've heard this term before, maybe not, but in 43 years of practice, I have come across many people that have done everything right. They've seen all the right practitioners. They've followed their exercise programs. They've followed all the advice that was given. And it just seemed like they would get benefits of whatever they were using as treatment, and it would like hit a ceiling and they couldn't get past that. That's what I refer to as healing or energy blocks. So I have no way of proving this other than years and years of experience of witnessing this happening. And I'll share some situations like this so that you can understand what I'm talking about. Now, when you're a practitioner, I don't know if you have this experience, but your family loves to have treatments. And the great thing about Meridian Balancing is when you're good at doing it, it's very quick. I can do a full Meridian Balancing treatment on someone in less than 5 minutes. So when I had family over for Christmas, they would retire to the living room and take their socks off. And that was my cue that I could roll in and do Meridian Balancing, which I didn't mind at all because, you know, when you get everybody chilled and relaxed, especially in a family situation, then things go more smoothly. So that was all cool. So I balanced my sister-in-law and brother-in-law, their children, and that was great. Easter comes along and we're over at my sister-in-law's house, and her daughter announces that they're pregnant. Her and her husband are expecting their first baby. So we're all excited, and she says, "Aunt Carla, I need to talk to you privately." So off we go into a bedroom, and she says to me, "You didn't know this, nobody in my family knew this, but we had been trying to get pregnant for over a year. We were starting the process of getting in touch with fertility specialists because we weren't conceiving. And when you did that Meridian Balancing for me at Christmas, my periods changed. They went to more regular. A lot of my symptoms I was having resolved, and here we are pregnant. And I believe it's because of what you did with the Meridian Balancing." So that's a very powerful story about not knowing anything about someone's condition or background or what they're dealing with, and having a very positive effect. This is another case that I had many years ago. It was a patient who had 2 months of very serious whiplash symptoms. She had done physio, she had done chiro, she had done massage. She was on heavy doses of meds. They were affecting her stomach. Now she was on meds for her stomach. I had offered acupuncture to her several times, but she was very needle phobic and she could not bring herself to agree. So I suddenly went, wait a minute, I could just do Meridian Balancing and see what that does without needles. And so I offered that to her. She agreed. And in one Meridian Balancing session, she felt a major shift in her body. Just things felt quite different, and things seemed to be a little bit better. Second treatment, which happened about 4 or 5 days later, and she came in Monday and she said to me, "I'm off all my medications and my pain is virtually gone." So again, that was the only intervention in the course of a week. Something shifted, something happened. It's not that everybody has this happen, but when it happens this dramatically and this quickly, you've just got to sit back and go, it has to be related to that. Another example I have is, again, people would come to me with physical therapy problems. So this lady in her 50s came with a sore shoulder. She filled out her intake form. I did her first visit. Even with a physio patient, I always Meridian balance first. So I did the Meridian Balancing. I did local treatment on her shoulder, physiotherapy treatment. I probably put in a couple of local acupuncture points into her shoulder and sent her on her way. A week later, she came back and said, "I have a question to ask you." And I said, "Sure." And she said, "I've been dealing with chronic morning nausea for over 2 years. I've seen all the doctors, they've done all the tests, they've even done a gastroscopy. They can find nothing wrong. It's like I have morning sickness every morning and I'm in my 50s. And they basically told me they can't figure out what's wrong and I'm just going to have to learn to live with it. Now, she had not put that on her intake form because she was coming to a physio for a shoulder problem. So she didn't think it was relevant. I had no idea that she had this challenge. And yet, after her first visit, that symptom was completely gone and it never came back. A little bit about what is microcurrent. I know there's more sharing than teaching, but a lot of people don't understand what microcurrent is. So we just want to make sure that we're all on the same page here. So a microamp is a millionth of an amp. Most people are familiar with milliamp current. Think of conventional TENS machines, items like the Dr. Ho. Those are milliamp, and they're only 1,000th of an amp. So microcurrent is a very, very tiny current. It's like 0.6 milliamps, very, very small. Now, the cells in the human body function at around 4 picoamps or 4 trillionths of an amp. And what's interesting about the body is the closer you get to the tiny current that runs the body, the more effective your treatments tend to be. In North America, we tend to always think more is better and bigger is better and stronger is better. But when it comes to our body, less is more. So these small therapeutic doses, they augment the body's ability to heal. And what's great about them is the patient doesn't feel the current at all. And there's no worries about overdosing or overstimulation or side effects. The tsunami waveform is the waveform that is put out by the Accu-o-matic machine, and it is very special because it goes 2.5 seconds with a negative current, and that helps the current to drive deep into the body to actually fire the acupuncture point. In my years of clinical practice, I find that it will fire an acupuncture point as effectively as a needle. I didn't find that would happen with milliamp. Milliamp current, you seem to get somewhat of an effect, but it wouldn't have that cumulative long-term effect that you have with needles and with the microcurrent stimulation. So it goes 2.5 seconds negative, kind of like a jackhammer, getting that current easily through the resistance of the skin into the body to fire the acupuncture point. And then it goes 2.5 seconds on the positive side. So what are the benefits of microcurrent? It's a very powerful way to treat any kind of soft tissue injury. It is very, very effective for wound healing and can give results very quickly. It accelerates that natural healing process. The treatment time with it is very short and results are very quick. And in our day and age, this is really important because people want to see results quickly. It's a very effective way to treat any acupuncture point on the body, a microsystem point, a scalp point, a body point. And this allows people to expand their client base to people that are afraid of needles, or maybe our needles are contraindicated, or treating small children. There's a lot of really great research on microcurrent, and this is some of the summary. This is a summary of some of the research findings. Cellular regeneration and increased protein synthesis happens when you apply microcurrent to the tissues, and that's where you get the enhanced wound healing effect. ATP is increased up to 500%. Now, this is the energy the cell needs for metabolism and help to repair injuries. Increased cellular membrane transport by 40%. That allows more of the nutrients to come into the cell, a lot of the waste products to flow out of the cell. This is going to speed up soft tissue, reduction of soft tissue swelling and inflammation. It helps improve DNA synthesis. So with this, again, helps with soft tissue cell regeneration. And it helps to activate the T lymphocytes, which helps strengthen the immune system. So this is a testimonial from one of our trained practitioners that is explaining her experience using Meridian Balancing. And she's very new at this. She just learned this not very long ago. and she has a very wonderful testimonial.
When I did my level 1 training, I went to go and just do some meridian balancing on my sister, and I did it because I think her back was sore or something. I don't remember. Anyway, so I just quickly did it, and she called me the next day because 13 years ago when she had her son, she broke her pelvis, and so she's had pain and discomfort for 13 years, and so she told me that she got up the next day and she had so much energy, and she cleaned her whole house. She like deep cleaned everything, and she was like, this is amazing. And we hadn't talked about price or anything like that, but she thought that it was $150 for the meridian balancing, and she's like, she was totally willing to pay that. She's like, I can't do this very often, but yeah, totally, I would pay $150 for you to come and just do the meridian balancing every once in a while. So just goes to show that the value in something just depends on like what it gives to the people. So yeah.
All right, I've got a few case histories with some before and after graphs to share with you to demonstrate how I use this in my clinical practice and the value of it. Being a pediatric trained TCM specialist, I see a lot of children. In fact, in my 43 years of clinical practice, my youngest paid patient was 1 day old, and my oldest paid patient was 101 years old. So I've literally had the gamut. I've also had 4 generations on treatment at the same time: great grandma, grandma, mom, and baby. In fact, this is the son of the fourth generation of the family that I've treated. So this is a 7-month-old that came to me because of being awake quite a lot at night, having teething pain. He was very hyper responsive to stimulus. So the tiniest little noise, he would really react strongly. He had some constipation because they had just introduced solids. He was losing interest in nursing, and so they were using a dairy-based formula during the day. He was fully vaccinated, and the last vaccine was a month ago. And after that vaccine, a lot of the symptoms had gotten worse and exacerbated. When I saw him, he had bright red cheeks. This is the meridian graph on his initial intake. Now, when we're looking at meridian graphs, we're looking at several things. We're looking at the number of meridians out of balance. Ideally, we'd have it as close to 0 as possible. We're looking at the distance that the meridians are out away from the normal range, and that red lines in the center of the graph is the normal range. So in this case, it's very much of a yo-yo kind of very, very high ones, very, very low ones. Sensitivity is another layer of imbalance that can be determined by doing this measurement. And a sensitivity of -80 is very, very out of balance. This is often the situation when people have anxiety or they have trouble sleeping, and that this energy is very imbalanced in their body. I treat a lot of children before and after vaccinations. When parents choose to vaccinate, I educate them to have their child come to me for meridian balancing prior to vaccination, to get all their meridians well balanced and to get them back to me as soon as possible after vaccination. And sometimes it's the same day. This mom didn't actually do that with this child's vaccinations. And this is a graph that is very common, a graph of this type after a child has been vaccinated. So I did a non-needle acupuncture treatment using the following points: stomach 36, spleen 6, stomach 44, do 14, LI 11, and heart 7. So that was the extent of this treatment. Mom was very busy. She couldn't come back for about 3 weeks, but when she did come back, she said he was very, very happy after the treatment. The bowel movements had improved. They were happening daily. Complete resolution of this hyperactive response, this sort of startle response for normal stimuli. And that is something that is very, very important, because seeing a child that is hyperstimulated like that after vaccine, just that imbalance can lead to further challenges with further vaccines and that. Still doing some struggling with the teething pain, but we did the meridian graph. Now the sensitivity is 0. So to go from -80 to 0 after one session is a really big improvement. He still had 11 out of balance, but you can see now that majority of the circled X's out of balance are right close to the normal range. They're not 4 or 5 lines out of balance. So we did the meridian balancing again. We treated the stomach 36 and 37 points, heart 7 and stomach 44, and he didn't need to come back after that. He's been doing well ever since. Next case is a 37-year-old female who was diagnosed with ulcerative colitis. On June 20th, she had a colonoscopy shortly before her session, and she had cramping, bloody diarrhea, bloating. Her whole body was a mess. She had left eye was red and swollen, not quite sure why, if it was some kind of allergic thing. Her anxiety had flared dramatically. She had skin hives that were showing up randomly all over her body. Her meridian graph at this treatment had 16 out of balance, so the majority were out of balance, and they were several lines away from the normal range. So in this treatment, I did the meridian balancing treatment protocol. I did another non-needle balancing protocol called vital chi alignment, and then we did a normal needle acupuncture treatment treating these points. She came back June 28th, and she had only one episode of cramping and bloating, no bloody stool, the hives were gone, the anxiety was significantly decreased, and her graph had gone from 16 out of balance to 0. Again, we did another treatment with the meridian balancing, vital chi alignment, and did a normal acupuncture treatment. This next case is a 21-year-old female, suffered from severe migraines for as long as she could remember. She had back pain. They had found a mass on her spine that had been removed. It was not malignant. She suffered from irritable bowel syndrome, anxiety, and depression. So her first graph had 8 out of balance. Wasn't too terrible. We did physio and needle acupuncture treatment. Her second graph was a little bit worse, a few more out of balance, but she had no headaches. Her back pain was better. Her IBS symptoms were better, even though her graph showed slightly worse. Her third visit, her graph is terrible. It's 14 out of 24 with -70. Now, when that happens, I usually check with people. Have you, like if people have food intolerances, have you eaten something that you shouldn't have eaten? Have you had any medical procedures done? Have you had any illnesses or injuries? Because these are the things that can throw off the meridian graph. Nothing was showing up. None of those things applied to her. And over the years, how I've described this is that I believe that what happens is we develop deep-rooted energetic imbalances that have gotten a deep grip in our body. And by doing the meridian balancing technique, I believe it's kind of like, imagine an ocean and the waves are just lapping in, and suddenly a big rogue wave comes in and it just stirs the water up and it's all murky and everything, and then it just settles out nice and clear. I believe that somehow we are stirring up some of those deep-rooted energetic imbalances that gets reflected in a graph like this, where it's massively worse. Even though the graph was worse, she still was feeling better. She had only had one migraine that had started the day before instead of her almost daily migraines. And she was a week pre-menstrual, so it was the normal timing that they worsened on her anyway. So even though the graph doesn't shows a lot worse, she physically wasn't feeling a lot worse. And over thousands and thousands of patients of having done meridian graphs, usually what happens when a graph gets dramatically worse, I can just about bet on the fact that the next graph will be normal. And this case really illustrates that, because she went from 8 out of balance to 12 out of balance to a -70 and 14 out of balance to 0. And at her 4th visit, she only had a slight headache. And on her 5th visit, she said it was the first time in 10 years that she had no back pain at all before her period, and her migraines were less. So I believe that this is a way to like clear healing blocks, clear energy blocks. I don't know how to describe it. I have no research to validate this other than years and years of seeing thousands of patients. So in conclusion, microcurrent is a very powerful, easy to learn, safe modality, and it provides excellent clinical results in all its applications. The thing I love about it is there are so many ways to use this beyond non-needle acupuncture and meridian balancing. It's an effective method to use as a standalone technique. So thinking of the testimonial that I shared by video, where she just went meridian balanced her sister just to be a good sister and had such a dramatic result. It's also a very powerful way to prepare your patient for any other treatment that you provide. Literally, nobody walks into my clinic that doesn't get meridian balanced on their first visit because of the success I've seen doing it. It often produces stunning results in very, very complex cases. Non-needle acupuncture using microcurrent provides a very effective acupressure technique in a very short treatment time. This allows you to attract clients that are reluctant to attend because they're scared of needles. And because it's considered acupressure, any practitioner can add this into the practice that they have, whether you're a massage therapist or chiropractor or anybody else, to augment what you already do and make it better. So we're ready for questions. Celine, if you have some there.
All right. Thanks, Carla. Such interesting cases.
Yeah, I've thousands. It was hard to pick because I literally, one of the things I think we're sending out afterwards is a list of, I think, about 20 case histories of a variety of different things so that people will get a better feel of the power of this method.
So we have some general questions and we have some specific questions of the cases. So the first one is, will meridian balancing help with cancer pain?
Okay, that's a really excellent question. And I have a very personal story with that one as well. Yes, I use it for people that are going through cancer treatment. There's no contraindications. The only contraindication that I know of, and it's simply because they don't know what the effect is not to apply microcurrent through the location of the cancer itself. But with meridian balancing, we're taking measurements off the hands and feet, the Accu-o-matic points of the meridians, and we're treating various points on the body that are usually not located in that area. Years ago, my sister-in-law was dying of stage 4 ovarian cancer. So I flew home, and when I got into their home, I really didn't think she would live through the night and get out the other, like I figured I'm too late to even help, with quality of life or anything. So all I did was just do meridian balancing and went to bed, said a few prayers, and got up the next morning. And there was a dramatic shift in my sister-in-law. Her color was better, like just everything was better. And so I did it every day for her for the course of a couple of weeks before I had to fly back home. And it really moved her quality of life along very, very dramatically. So it's a powerful technique to use for people going through really serious chronic health challenges. It's also a fabulous technique to do with people who are pregnant. Absolutely wonderful to support pregnant women through all of the months of their pregnancies as well.
Oh, how often would you do treatments for different conditions? How long would you continue treatments for?
Okay, great questions, guys. All right, so when I have someone, I get them in, I do meridian balancing, usually every time I see them. So if they're coming twice a week or 3 times a week, I usually do it every time I see them until their graph is normal. Now, normal doesn't have to be 0 because this is a technique that requires, there's operator error that can happen, when you're taking the measurements. So what we consider normal is if a graph has 3 or 4 very slightly out of balance meridians, then that's, I would consider normal. So in that situation, I would stop doing the meridian balancing. Let's say it's a person that has a long-term chronic problem, and I would put the meridian balancing back in if they regressed, or if they had an additional injury, or there was something that happened to them that made things move backwards again. I have a very interesting case of a boy that came to me for attention deficit disorder and hyperactivity. And he was getting, D's on his report card. So I did his meridian balancing. He only came for 4 or 5 sessions. He was getting A's and B's on his report card. It was a really dramatic improvement, never used any needles. About a year or so later, he came back for a different problem. I believe it was an orthopedic problem. And so I was able to, of course, I did meridian balancing on his first visit. I was able to look back in his chart and see his first meridian balance from his first round of treatments. And the graph, when he came the second round of treatments, his intake graph was not as bad as his first one, but a little bit worse than the last one he'd had on the first round of treatment. So the other thing with meridian balancing is the body likes to be in homeostasis. So when you get a person meridian balanced, a lot of times it will hold. It doesn't mean they're not going to get sick or have challenges with their health, but often they're more resilient. They get through it quicker. And so in my pediatric practice, I get very busy in August. People bring me their kids to get them balanced up before school, because they know that if they do that, they're the ones that either don't get sick or they get sick mildly and they get through it really quickly. So that's kind of the pattern that I use.
Okay. So on the case study with the 7-month-old child,
yes,
why are the first red line group centered at 100 and the second treatment groups at 200?
Okay, great question. So because this is case histories and not actually teaching the protocol, I'll just explain it that when you do the measurements, you have to determine what the normal zone is during each session. And you do that by adding the highest and lowest number on the graph together and dividing by 2. And that ends up giving you your normal range. So that normal range could fall higher or lower on the graph. Where that normal range lands on the graph is not relevant to them being more or less balanced. It's the number of meridians out of balance and the pattern that they have. That is the relevant part.
So as long as they're kind of the range is closer together.
Yes, yeah. Exactly. Got it.
How do you calculate the sensitivity with meridian balancing?
Okay, so again, this is kind of a technical question on the how to, but when you first take your first measurement, the graph or the meter on the Accu-o-matic goes up to 200. So when you take your first measurement, you will get some people where the needle will deflect and go to 200 and look like it would go to 300 or 400 if it was able to. That is when you adjust the sensitivity of the meter so that you can actually take the reading. And that's where you get that sensitivity number from. And that just indicates a very extreme imbalance of energy in the body.
All right. I think you've answered this one, but maybe you could quickly touch on how is this different from using the Pointer Plus?
Excellent question. Pointer Plus is milliamp. This is microamp. So basically, as I said, so this is another example. Back when I worked in the University Hospital in Edmonton, I was using the Pointer Plus for people that were needle phobic, and it was before I purchased my own Accu-o-matic machine. And what I found is people would get some results, but they would very quickly just go back to what they had before. It didn't seem to give the cumulative effect that you would normally expect with an acupuncture needle treatment. You get that cumulative benefit of each treatment. And I found with the Pointer Plus, that it didn't give that cumulative effect, and the results weren't as good and didn't last as long. When I started using the Accu-o-matic, and of course having a very large caseload of children where I was treating them without needles, I could see that we were getting the cumulative effects. We were getting similar effects to needles. You may need more treatments if you're not using needles in the number of treatments, but you would still get to the same endpoint. But that is not necessarily the case, because sometimes you get results as quick. Couple of my cases that I had is I treated a 4-year-old and 6-year-old brother and sister, both autistic, one very severe, one mild. I treated them from age 4 to 6 to age 18 to 20, literally through their entire life that way until they were pretty much adults. And these were the highest functioning. The severely autistic child, eventually, he was like head banging and you know, the really severe. He did eventually become verbal, and never used a needle on any of them. They were never medicated with any medication. The parents obviously were very involved with the autism community and would go to autistic conferences for autistic children. And all of their people that they'd meet were amazed at how highly functioning her children were, and not medicated. So yeah.
What a relief for a parent with 2 kids.
Yeah, yeah.
So another technical question, how long does it take to stimulate an acupuncture point?
8 seconds.
That's fast.
Okay, I have another great story for you. All right, I had a patient that came in late for his first visit. And technically what we should do as practitioners is send them on their way and rebook them. But I've always got a big heart, and I'm like, oh, okay, come on in. So this guy came in late. He was a real estate agent. His time was money and valuable, and he rolled in late. So I did my initial assessment with him. And I said, look, because you were late, I'm just going to do a non-needle treatment. We'll move on to needles next time. So I did Meridian Balancing and I did a non-needle treatment. Next time he came on time, I did a full acupuncture treatment, you know, needles in, laying there for 20 minutes, blah, blah. Did 2 or 3 treatments like that. And he rolls in for his 4th treatment. He goes, I got a question for you. And I said, shoot. And he says, that first treatment you gave me worked just as well as those other ones where I'm laying there for 20 minutes with needles in. Can we just go back to just doing that? Because time is money and I got to get going. And I'm like, cool. Yes, I can do that. And so we continued on with his treatments using just the needleless technique. So there you go.
8-second needles.
Yes.
Can Meridian Balancing help with enlarged prostate?
Meridian Balancing can help with everything, because again, it's a root treatment. When you think of balancing and harmonizing your autonomic nervous system, you've heard the case histories, like the lady with 13 years of back pain, and her sister rolls in after learning how to do this and does it for her, and is suddenly having all this improvement in her pain and her energy levels. It is something, it's the icing on the cake of, it's on the icing on any cake you bake, is how I put it. So any treatment, any condition, Meridian Balancing is always going to have the potential to help dramatically, even just have the potential to help other things to work more effectively, and it's never going to do any harm.
The next 2 questions are kind of a little similar. They're both technical about the baseline. So how do you determine which meridians are out of balance? How do you determine the points to bring back the balance? It's more of a teaching question.
Yep.
And can you explain how you arrived at the sensitivity and baseline, as the numbers are different for each client?
Okay, so first question, let's read that first one again.
How do you determine which meridians are out of balance, and how do you determine the points to use to bring them back into balance?
Perfect. Okay, so we determine the normal zone for the client's graph. We draw in the normal zone, and then we count the meridians that are out of balance that fall outside of that normal zone. In Chinese medicine, we have tonification and sedation points. So any points that are excess, we treat the sedation point. Any points that are deficient, we treat the tonification point of that meridian. That being said, I have also developed kind of a shortcut meridian balancing method that uses 6 master acupuncture points that can also be very effective. So this allows us to be a little quicker, and sometimes that can be a benefit as well. But basically, we're following traditional Chinese medical theory, tonification and sedation points.
And then the arriving at the sensitivity and baseline.
Okay, so sensitivity, again, if the meter goes too far and you can't read it, there is a knob on the machine that you adjust the sensitivity of the meter, and you take that sensitivity reading off of there for your chart. And the normal zone it's going to change with each person because it's the highest and lowest reading on the meridian graph divided by 2, and then you draw a line 10 points above and below, and that gives you the normal range for that client.
And for any of the viewers, if you're wondering about this chart, it was in one of Carla's cases. If you go back and watch the video of this, you'll see what her charting looks like.
Yeah, there's an actual meridian graph, a chart that you fill in. So you literally take the measurements off each meridian and put an X on the chart, and then you end up with your final outcome there.
Is there any contraindication of microcurrent therapy in cases with pacemaker, epilepsy, or arrhythmias?
Okay, so if you go by the books with microcurrent, then you're not supposed to put microcurrents through the thoracic cavity if people have pacemakers and that kind of thing. Those are more medical legal contraindications, I would say. Like, you really aren't going to cause anything, but they put that on to legally protect themselves. I have no problem doing meridian balancing on someone with any of those conditions. There's no contraindication for that.
What about your results with stress, anxiety, depression?
Fantastic. Very good. Yeah.
And how are you charging for it? Is it included as part of your treatment, or?
Okay, so people pay for their acupuncture. I call it total body wellness because I've expanded my skills to include all kinds of wonderful natural modalities. So it's part of their treatment. So it is, if their treatment, one of the things I've learned as a practitioner is you don't equate what you charge with how long it takes. You equate what you charge with the value you bring to the table. So for example, the fellow that said, hey, time is money, can't I just have meridian balancing and non-needle acupuncture and I could be out of here in half the time? He was still getting a great treatment, still getting great results. I wasn't changing my fee because he was in my clinic for less time. So yeah, it's part of what I do. So if I'm treating someone with physiotherapy techniques, it's just part, it's an integral part of my treatment. We live in a very small town. We live in a town of 6,000 people, rural Alberta, close to the Rocky Mountains. In my career, I've had people who have traveled from Vancouver Island, from Saskatchewan. I have people that have come from very, very far distances to see me because of my reputation for getting results in very, very complex cases. There's a lot of reasons that can be, but I definitely think meridian balancing is one of the cornerstones of that. In our careers, as we all go through our lives and as professionals, we pick up various techniques and things that we're like, wow, this has really changed the course of my career. And meridian balancing and using the microcurrent machine is one of those for me. So it's just an integral part of what I do.
Can meridian balancing help achieve conception for women with many failed IVF attempts? Can it help during the first 12 weeks of pregnancy when they're most susceptible to miscarriage?
Yes and yes.
Great. where can practitioners learn the meridian balancing technique? Actually, so if whoever asked that question wants to stay on after the Q&A, Carla will talk a little bit more about her courses and what that includes.
Yeah.
Can meridian balancing be combined with PEMF treatments?
Yes, I actually do, because I have a PMF unit in my clinic as well. Or not my clinic anymore. I sold my clinic 3 years ago, but it slips out, my clinic. Yes, it could be combined with that. Absolutely.
Somebody said you look very useful for a grandmother.
Well, I'll be 66 next month, so I walk the walk.
Is that the personal meridian balancing and second chance facelift?
Yeah, that's second chance face, yeah.
Does the machine give you the points on the graph?
The acupuncture points are listed on the meridian graph that you treat, yes.
I'm not sure about this question. Can you recommend where to purchase a chart for locating various meridians? Oh, I'm looking specifically for pancreatic cancer support.
I think.
Yeah, I don't know if that's okay.
Yeah.
Are you incorporating the machine with facial needling?
No, we don't do any facial needling. I'm trained in facial needling, and the technique that we developed works better than facial needling, and you don't have to stick needles in people's faces, and you don't have to worry about bruising people, because you can be the best acupuncturist in the world and cause a bruise, and if it's on their face, it's not cool. So no, I am trained. I have done all the training for facial needle facelifts, but what we put together is better.
Do you compare readings taken initially and at the end of a series of treatments, and what do you find?
I compare the readings on every session. So when we look at the first session, then we do, like, let's say they're coming twice a week. And I do, so the AJ testimonial with those 4 graphs, literally each time I do a graph, I look back at the past graph and I look at it. If you want to delve deep into traditional Chinese medical theory, when you know what these meridians do in the body, it's kind of like an objective pulse diagnosis in a way. Pulse diagnosis is very, very hard to learn. And so meridian balancing can kind of mimic that. Case history that I had with this one, I had a woman who had very severe menopausal symptoms. And when we did her meridian graph, her liver energy pathway was very, very high, very out of balance. For whatever reason with this woman, every treatment we did, it would come down 1 notch. And then the next treatment was 1 notch. And this is another one of the great clinical benefits of having a tool like this. She would come into my clinic and go, I can't wait to see what my liver meridian's doing today. Because it was literally like walking down a set of stairs. It just went down one by one by one, and her symptoms kept getting improving. So people, it's a way to often validate your treatment as well. People like to see test results. So having a meridian graph, someone, maybe they feel a little bit worse, but their graph is a lot better. It's easy to explain, well, look, deep down, things are moving in the right direction. You're just going through a little bit of a rough spell here. So people are very engaged with seeing the graph, having it done, and helping to use that as it's part of your toolbox. Chinese medicine, you look at their tongue, you look at their face, you take their pulse, as a physio, we, measure range of motion and all these things. It's just another tool in the toolbox that helps you to evaluate, plan treatments, and explain, maybe clinical results to people when they're coming to see you.
That's great. This is the last question that I have. Diabetic neuropathy, can I help with that?
again, there is no reason not to do it. And I have had patients where it has helped that as well. So anytime you're getting the body functioning better on a deep level, having that autonomic nervous system functioning better, ATP flooding into the area, yeah, there's just so many benefits to microcurrent that it's going to, it may not take them from having the problem to not having the problem, but as practitioners, our job is always to get the best physiological function with what we have in front of us. And sometimes there's things that are beyond repair, but if we can get them to have, 70% function instead of 30%, and 80 is never going to be possible because of structural or whatever, that's still something that's really, really valuable. And this is just another tool. I think the case histories that you can see, like my niece, she would have been into fertility treatments. She would have been into all kinds of things, right? And that one, and after that, after they had their first baby, they had, their second with no problem after that. So how it works, why it works that dramatically for some people, my theory is that it helps to balance the autonomic nervous system. What I explain to patients is your autonomic nervous system is kind of like the conductor at the front of an orchestra. And, you've got to have the flutes come in and the oboes come in and the string session come in at the right time. With our Western medical testing, we can test things, but a lot of times our testing isn't good enough to sort of maybe notice when something comes in a little late or a little early in that orchestra. So the way I like to describe it is meridian balancing is kind of like getting that conductor to have the entire band playing harmoniously together. And when that happens, whatever's going wrong in the body is going to move in the right direction. Sometimes it's dramatic and very quick, like the lady with 2 visits and the MBA. Like I was speechless. I could not have predicted that in 2 visits, she'd be drug-free, pain-free, and just everything was behind her. So it's a bit of a mystery, but it's a good mystery.
Thank you so much, Carla. This is great. It was very exciting.
Yeah.
To hear how easy it is, how quick it is.
Yeah.
So if there's no other questions, I think we'll wrap up here. And again, if anyone wants to stay on and hear a little bit more about the Second Chance Facial Rejuvenation course, that'll be great. So we'll hang tight for a second and we can stop recording this. All right. So maybe, Carla, you can let us